habits do have an influence on our fertility. And it is widely known, and I'm sure many of you are aware, that folic acid intake in women is very important and crucial for preventing any sort of abnormalities in the first trimester in the fetuses. Aside of that, generally women must be prepared before getting pregnant, both with physical activities as well as consumption of the right kind of food. So I can describe that there is a variety of food out there in our Indian diet itself which are highly contributory to a healthy conception. Be it if you're vegetarian or non-vegetarian or a vegan or an experimenting vegan, there are wide choices out there, and these are some things that we don't pay much attention to but are very much available in our markets, and we need to consume them, such as green leafy vegetables, any sort of pulses or lentils, dairy products in moderation. And for vegans, a lot of nut sources are available in the like nut milks, nuts themselves, vegan cheese and vegan protein in the form of tofu, seitan, tempeh. So there is no dearth of food items that will contribute and help us enhance our chances of fertility. But along with this kind of dietary consumption, I also will recommend lifestyle changes, which I will talk to you about later. But basically our very own South Indian diet with a lot of millet varieties included, and cutting down on excessive dairy consumption, but having it in moderation is highly contributory. However, with all this diet, as I've mentioned, it's also recommended that you consult your obstetrician and gynecologist, who will recommend folic acid, calcium and antioxidants or micronutrients to be swallowed as pills, just to supplement your regular intake, because not many of us are able to meet our required daily allowances in the food that we consume, especially with a busy lifestyle. I would honestly request that couples consult even for diet management prior to trying to conceive. Stress does have a relationship with couples who are trying to get pregnant, and it does possibly have an impact on how they deal with the high expectations around getting pregnant, or having a stipulated time to pregnancy time frame, which possibly increases their stress levels. Newly married couples who are under pressure, peer pressure, and couples that are juggling careers and still trying to get pregnant, trying to find the time to get pregnant, or couples that have already gone through treatments and are struggling and possibly have to enter an IVF program. All these can contribute to stress. So it's basically a lifestyle combined with individual expectations and requirements. So whether stress really causes infertility, there is no substantial evidence, but whenever you have anxiety and suffer from depression, or have a change of diet or environment or anything, or a sudden burst of physical activity, we all know that it influences our hormones. And for women, there might be a shift in their period, and they may have weight loss or they may have weight gain, and this may cause hormonal imbalances which may prevent ovulation. So this is well known. But apart from that, even the struggles of trying for a pregnancy, going through an IVF program and becoming negative, all this are interrelated. So stress begets infertility, infertility begets stress. And although there may not be an intricate relationship, the very fact that it affects mental health is easily a contributor to the results as well. So it's highly advisable that couples have a counseling session when they are trying to get pregnant, or they have anxieties that they need us to ward off and help them through with it. And also, if they have tried and they have not been successful, or if they have failed an expensive treatment cycle, it's very, very important to integrate counseling services in your practice in order to enable them to regain their confidence, and maybe take subtle treatments that might alleviate their anxieties or depression. When a couple has been trying to conceive and they've probably tried for 6 months to a year or even 2 years, the first step that they should ideally take is to meet a fertility specialist who can guide them through, who can evaluate them with minimal investigations to rule out basic factors that may contribute to their infertile condition. Or if they are perfectly normal, they can assist them with medications that will help with ovulation and better performance or a chance at getting pregnant. Ideally, I would suggest, because of the increased awareness these days of female age-related infertility, I would always ask young couples to visit a fertility specialist first, get a basic know-how of how to try, help them with their lifestyle and diet changes, even undergo some kind of counseling in case they are busy with their careers, and then proceed, because a woman's body is basically unprepared, and whether she knows it or not, she may have neglected certain nutrients in her diet and things. So it would be great if we could supplement her prior, because it's ideal to take at least 4 to 6 months of folic acid, or at least a minimum of 4 months of folic acid when you're trying to conceive. So this is what I would recommend. But once you have tried and you approach the specialist, we do a basic semen analysis and certain hormonal evaluations in the woman, and we also do an ultrasound of the pelvis, and given that everything is normal, we may assist with ovulation induction drugs and possibly even allow you to try natural. It's only when all else fails, the minimally invasive treatments and evaluations, then does one even consider IVF. It is not the first line of treatment, other than some very, very niche conditions where we've identified severe factors contributing to their infertility. So first, number one, no one should get perturbed and anxious about this, because we're always there to help. Second, we are there to guide you through the treatment processes and offer counseling when required. And third, invariably you will end up in a successful pregnancy and childbirth, or any other options that we're here to support you for. So IVF, or in vitro fertilization, is basically manipulation of a male and female gamete, that is the egg from the woman and the sperms from the man, manipulated under controlled laboratory conditions to enable fertilization, which is union of these gametes, which what contributes to a baby. And we grow them to a particular stage, which we classify as cells. And it ranges from 2 cells to 4 cells to 8 cells to a compacting embryo to a blastocyst, which ultimately results in a pregnancy. This is to put it in as simple way as possible, but it involves a lot of intricate detailing within the lab environment, which contributes to success. Aside of this, I wouldn't say that this is a process that you should, be scared of, but you should be well aware of what you're undergoing, and you should have an open conversation with your fertility specialist on what it entails. So basically, to put it in a nutshell, we evaluate the male and female partners, and we have the female partner undergo multiple injections which produce multiple follicles which may contain the eggs, because we are not looking at getting one, but we want multiple follicles and eggs, because the more we get, the more numbers of embryos can be formed. So when she undergoes this, what is called as controlled ovarian hyperstimulation, we find a time when we want to extract them from her body, which may involve sedation or anesthesia, both of which, when done under expert guidance, would produce very, very less harm or no harm. And then we fertilize it with the male sperms. So it is under anesthesia, and the transfer of these formed embryos back into the uterus of the female is like a daycare procedure and does not involve any risks, and can be done well in a relaxed manner, and one can just breeze through this process most often. So I would say that one should alleviate any fears about this whole procedure, but one should learn and be aware of everything that entails the whole process, which is good for you and good for the treating physician as well. It's ideal for young couples to use a non-invasive form of contraception, and by that I mean that the woman can have a low-dose contraceptive pill or a standard dose depending on whether she is already having some form of issues with hormones like PCOS, that is polycystic ovarian syndrome. We also take into consideration before prescribing her general health condition, any history of deep vein thrombosis or medical disorders or anything. We first evaluate before prescribing these pills. By and large, they can be used long term. By and large, there are very, very minimal risks, and they are highly potent for contraception and also non-interfering, because you just keep the pill going, and when you want to conceive, then you stop the pill and your fertility returns in a short while. Barring this, for couples that have not had a child before, I would be reluctant to introduce any form of contraceptive device into her body. More so because it's invasive, it's going to sit in the uterine cavity, it may produce infections, it may cause tubal block. All depends on the person's hygiene, safety practices, and immunity. So I would by and large not advise that. Female condoms are available. Men can wear condoms. Men can also practice withdrawal technique or coitus interruptus. All of these methods don't have a high rate of protection, but still they will protect you from sexually transmissible infections and other infections as well. So I would advise, or my favorite would be a nice low-dose contraceptive pill, or use condoms in a nice, in a very, very judicious way to make sure there are no leaks and stuff. For a male, there is only a permanent method like vasectomy available, and for temporary measures they have to use one of the physical methods, as I've already elaborated before. No one wants a permanent method, of course, because we are still trying to get someone pregnant here. There are pills in the market, possibly in research stage, hormones which contain progesterone, and I recently read about devices that could be inserted in the vas, intravas device, or something that could be injected in the vas that could temporarily suppress sperm production or cause death of the sperm so that they don't proceed beyond and make the female pregnant. But these are possibly under research, and I have not heard of them being used here in our country. So these are all under research and people can read up about them. Yes, the contraceptive pills, although highly popular and highly effective and do their job really well for not only contraception but other medical conditions that we deal with, that is mainly hormonal imbalances, they do have marginal weight gain. They can produce mood swings and mood changes, but it is highly individualized. Many people are comfortable. People can consult with their obstetrician and gynecologist or fertility specialist as to what the dosing would be appropriate for them, because sometimes they could get an early withdrawal bleeding, or they could get into an irregular cycle because the dose may not be optimum for them. There are many varieties available in the market, and it would be ideal to discuss with your specialist on all their effects and who should take what kind of pill. But by and large, when you don't have a very compounding blood related disorders or coagulation disorders or a medical disorder that is under high control, you can take the pill, and they cause very minimal side effects. And like I said, yes, it could be associated with both of the changes like weight gain and hormone changes. mood swings, but by and large they are safe to take, and you should possibly consult with a fertility specialist to know more as to what would be suited for your body. By and large, there are two conditions which are very prevalent in Indian women. One is polycystic ovarian syndrome, which the incidence may range from anywhere from as low as 3% to almost 30%. This again is individualized in practices. Each one's practice may see more or less cases, but it is overall very prevalent. The second one is endometriosis, which may be prevalent in the range of 22 to 25% or even as high as 28%. Aside of these, yes, women with chronic medical disorders like hypertension or known diabetes, juvenile, or a age-related onset of non-insulin dependent diabetes, any sort of epilepsy, heart disease, kidney disease, autoimmune disease, arthritis, the list can go on. So, but if we were to take what is most prevalent and commonly encountered in fertility practice are PCOS and endometriotic patients. So the treatment is highly individualized and directed to a lot of lifestyle changes, diet changes, use of hormones to manipulate these conditions, and one should not fear these because in the hands of a good expert, however severe these are, they could be curtailed and controlled in order to effect fertility. So in PCOS, we largely advise lifestyle changes and dietary changes and put them on supplements, and also regulate their menstrual irregularities, which is the most important symptom that they suffer from. Aside of these, from a fertility specialist point of view, we do have invasive procedures that we perform in them, which are not harmful but highly helpful, in the form of laparoscopy and sometimes an ovarian drilling. So endometriosis is like a chronic disease. It has exacerbations and remissions, and it affects literally every part of the body, and especially the pelvis and the abdomen. And it causes cysts in the ovaries by burrowing into it and causing chocolate colored fluid to accumulate, and that will suppress the ovarian fertility, and possibly the eggs that we retrieve from these women may also be of poorer quality. But all is not lost. If one comes with anywhere from a mild to a severe case, we are there to individualize your treatment protocols and intervene when surgery is required or an intense medical treatment is required. We suppress the condition and then we try for fertility as soon as possible. The ideal thing in both these conditions is not to wait for too long, because the damage could increase as the longer you wait. Of course, all of them entail a lot of lifestyle changes, like I already elaborated. And given that, along with the current medical and surgical therapies that are available, which are cutting edge, one should really hold hope and look forward to conceiving even if they have these conditions. And it's always an integrated team approach where medical disorders are concerned. We will have a physician or an endocrinologist or a cardiologist or a diabetologist. It's always a teamwork to ensure that the patient is kept safe throughout her treatment procedures. So our lifestyle choices do make a difference in our attempt to getting pregnant, simply because it's our personal habits, our diet, and our interest in physical activity that maintains our body mass index, which is highly crucial for improving our chances. For instance, a woman suffering with PCOS who may be obese needs to lose at least 5 to 10% of her body weight to improve her chances for ovulation. Similarly, just an obesity itself intrudes a lot into the hormones, and also it is difficult to treat such patients if we want to do interventions surgically or even attempt childbirth. So it's healthy to maintain your weight for height for both men and women. As far as personal habits are concerned, the 3 most important things that will crop up in anyone's mind is the fact that their consumption of alcohol or smoking is going to impair their chances, or even the use of recreational drugs. And it's very important to stop these prior to conceiving. Alcohol has been used in moderation and results have been good. However, if the consumption is more than usual, you will need to cut it down before trying to conceive. But if you already have an issue, like say if it's a male factor infertility, it would be ideal to actually let go. After all, it's only for a couple of months that you need to really look after yourselves, and I'm sure it would have a long-term impact on your health as well as a short-term time to conception. And I think it's very, very important we inculcate some form of physical fitness in our daily routine. It could be actual couple workouts in a gym so that they motivate each other to lose weight and maintain weight for height. So this is not like aiming for size 0, but it's aiming for the ideal weight. And they can also do yoga or meditation, because whatever you're trying to do, it's going to calm your mind and it's going to help you focus on the treatment. It's going to help your mind to open up to the possibilities and also keep your stress levels down. I've already mentioned quite a few times that age for a woman is very, very important where her biological clock is concerned. More so because we cannot compare our bodies to Caucasian women, because the statistics are all different and our genetics are different. And like I said, counseling is very important for women to make these choices. These are difficult choices sometimes when you have an education program going on or a high-flying career, and you are hesitant to push a pause button there. So my ideal would be, or rather ideal advice would be, to have one child before the age of 30 and aim for your second one by the age of 35. And if that's not possible, at least one child before 35, because from 35 and going forward, there is an age-related decline of the number of eggs that are available in our ovaries, and also the quality. So you may be increasing the chances of chromosomal abnormalities and possibly also reducing your chances of spontaneous and natural fertility. Miracles have happened. People who have really looked after themselves do conceive naturally and who have no compounding factors, like I've said earlier. So it would be great if women actually came forward and had a session with a fertility specialist to know and to understand her chances of fertility at any given particular age. And I would say that session should be ideally before 35. We could screen for thyroid, we can screen for hormonal imbalances, we can have a physical check, we can guide them. And childbirth, well, we've had women between the ages of 40 and 50 deliver. Now, more than age, it is their physical condition, their medical disorders if they have, is it under control, how are they fit physically, rather than the age itself, which may impact the process of childbirth. In good hands, everything always goes well, and if it's a multidisciplinary approach, it's even better. So I don't think one should fear there, but one should raise their awareness, must have conversations, must go and meet a fertility specialist or an obstetrician gynecologist to know what entails for them if they want to start late.